Today on Investigate TV Plus, far from home.
She's an assisted living resident, but cannot be located.
Hundreds of elderly patients wander away from assisted living and nursing homes each year, some with tragic results.
We take an in-depth look at a crisis in senior care and explore solutions to ensure the safety of America's aging population.
Plus, doctors feeling the burn.
So when you go home at night after putting in a long day, you may still have 3 hours of documentation and paperwork.
We examine why more physicians feel overwhelmed and how a blood test could act as a barometer for burnout.
And a life-changing event inspired a young woman to share her story of faith and resilience.
I would say I'm very accepting of my reality now.
And encourage others to overcome odds. In-depth stories that inform and inspire. You're watching Investigate TV Plus. Facilities entrusted with providing a safe place for the aging face criticism after those considered cognitively fragile have walked away unchecked. I'm Tisha Powell.
And I'm Lee Zurich. The Alzheimer's Association says 60% of people living with Alzheimer's or dementia will wander. And if they're not found within 24 hours, they may not be found alive. A 2023 investigation by the Washington Post found of the more than 2,000 people who eloped from assisted living or memory care facilities since 2018, nearly 100 died.
Investigative reporter Andy Parati takes an in-depth look at the number of care facility elopements and speaks to a family seeking to prevent another tragedy.
Right now, there's a search on for a missing 89-year-old woman in Marietta.
She's an assisted living resident, but she cannot be located.
Police say this woman, Patricia Mealy, left her assisted living facility on Whitlock Avenue.
We've done a full sweep of the property, and we cannot locate this resident.
A call for help this past November to find a beloved grandmother who vanished from Greenwood Place, an assisted living facility. No security cameras inside to aid in the response. Karen Phillips is Patricia's daughter.
She's like, what happened?
Garrett is her son-in-law.
That's a pretty big, basic foundation of their job is don't lose our mother.
After nowhere to be seen for 2.5 days, police get the call everyone feared.
We begin with breaking news out of Marietta. A tragic end to a desperate search. Police say Patricia Mealy was found dead days after she left the Greenwood Place assisted living.
Patricia's body discovered in this pond inside Kennesaw Memorial Park, a cemetery less than a mile from the facility where she went missing. Investigate TV spoke to Patricia's family just hours after they identified her body.
Someone knows what really happened. Someone who was on site there that night knows what he or she did or did not do.
According to her family, Patricia moved into Greenwood Place 22 days before she disappeared. They say staff knew she was cognitively impaired, explaining that Patricia once locked herself in her own room, mistook a fire alarm for an elevator button, and told everyone she worried about getting lost.
She told me that I would get lost. So what do I think she was thinking? Probably just terror at like her biggest fear happening.
The operator of Greenwood Place, Terabella Senior Living, declined interview requests, but in a statement said, "We're fully cooperating with law enforcement and providing unnecessary information to support their efforts." An investigation by Investigate TV uncovered Patricia's disappearance. Something regulators call elopement is one of hundreds that have happened at assisted living facilities and nursing homes across the country. According to an analysis of ProPublica's nursing home inspection data, from 2020 to August 2024, state health officials cited at least 1,100 nursing homes for serious elopement violations. That includes this 88-year-old Arkansas woman who died after walking away from her facility in 2021, one day after she was admitted. This elderly South Carolina man found dead in a pond after wandering away from his facility in 2022. And this woman in Arizona who died from heat exposure after walking away from her memory care home.
Someone found her body in a canal 2 miles away.
In Georgia, state regulators cited at least 6 facilities for elopements over the past 3 years. Nearly half of them also cited for staffing shortages. Records from the Georgia Department of Community Affairs show Greenwood Place, where Patricia vanished, cited 3 times for staffing shortages, months before she went missing.
Andy, staffing is always the issue. It's always the issue.
Attorney Mike Prieto specializes in nursing home litigation and represents Patricia Mealy's family.
You see high turnover rates, and you see the pay just barely above the poverty line. And you can't have continuity of care when you have a constant turnover of these care providers.
According to SeniorLead.com last year, an industry think tank, Georgia ranked as the 3rd worst state in the nation for elder care staffing.
And as Wall Street firms take over more nursing homes, quality in those homes has gone down.
To address the problem, the Biden administration announced new staffing mandates, which will require at least one registered nurse working 24/7 at facilities that receive federal subsidies. But the nursing home industry is fighting back. The American Healthcare Association filing this pending lawsuit, seeking to reverse the mandate, claiming it would cost Georgia's nursing home industry $187 million a year, and it would be impossible to find enough staff.
It's really tone deaf at a time when we're in a shortage. That shortage has been exacerbated by COVID, and now they come in with a proposal that's going to require even additional staff.
A family mourning the loss of their matriarch, desperate for answers.
We think someone ought to be held accountable, and we can't imagine this happening to anybody else.
Elizabeth Edgerly with the Alzheimer's Association says wandering poses a serious safety challenge, but caregivers can take steps to protect their loved one.
So what I like to do is really pay attention. When is the person kind of up and walking around and restless? And is there something we can do to engage them? Why don't we go for a walk together, if possible? Or do some exercise of some type, maybe watch a show with dance or do chair yoga. There's lots of different things you can do to burn off that restless energy.
If someone does leave, the Alzheimer's Association says you should start search efforts immediately. When looking, consider whether the person is right or left-handed. Wandering patterns generally follow the direction of the dominant hand.
If you know that someone has just left, give it a good at least 15 minutes of searching for the individual in the immediate proximity, and then call the police. And you want to report the person as a missing, vulnerable individual, a vulnerable adult.
Edgerly also recommends getting a medical ID bracelet that alerts authorities the person has memory issues.
You can find more caregiver resources on the Alzheimer's Association website at alz.org or call the Alzheimer's Association helpline at 1-800-272-3900. Still to come, a change of pace.
They just run so much faster than you, so you don't really get to meet them.
We hit the pavement with a club encouraging runners to be the tortoise and not the hare.
But first, overwhelmed and overstressed.
So when you go home at night after putting in a long day, you may still have 3 hours of documentation and paperwork.
We examine a growing epidemic in the healthcare system and how medical science may help find a cure. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
If you're feeling under the weather, chances are you'll reach out to a doctor to find out what's wrong to get peace of mind.
Yeah, but for those whose job it is to heal their own mental wellness may be a personal struggle they suffer in private. In 2023, the American Medical Association found almost half of physicians reported suffering a symptom of burnout, which can include exhaustion, compassion fatigue, alcohol and drug addiction, and even thoughts of suicide. But there is hope for our frontline medical workers.
Reporter Ann Emmerich takes a deeper look at possible causes and the science that could provide a treatment.
Dr. Bill Baer wants to prevent illness, not react to it. He's practiced internal medicine for more than 30 years and says to make ends meet, doctors have to see more patients and turn them over quickly.
So when you go home at night after putting in a long day, you may still have 3 hours of documentation and paperwork and answering messages to go through. So now you start sacrificing family time and things along the lines that you would like from your own self-enjoyment.
It's a prescription for burnout, a real medical condition affecting more than half of the nation's doctors. Dr. Baer says burnout led to his decision to leave private practice.
It was missing a couple of the kids' events. And with 4 kids, I just was struggling with, time inefficiencies and, trying to prioritize my family, but unable to do so just because the job mandated just so much of my time.
He's among many doctors who say the very system we rely on to keep us healthy is harming the health of those delivering that care.
Burnout or low energy, it's a big problem in healthcare.
Dr. Bengt Arnetz practices medicine. He's also a professor at Michigan State University and a researcher on a mission to keep doctors and nurses from burning out.
If you sit with a patient, you're much less attentive. You have much harder time to remember what the patient says, and you're much less intellectually sharp. So you don't function at the top of your capacity as a provider if you burn out.
Dr. Arnetz studies biomarkers in the blood to figure out how to prevent and treat burnout.
But people have low energy, they say. So how do you measure that in the blood? So we found a new marker to look at in blood, an anti-inflammatory marker. Or we look at how active are your neurons in the brain, how much do they grow, how much do they interact, and you can measure that now.
Measurements that can help heal a sick patient and a healthcare system seeing doctors quit the profession at an alarming rate. Dr. Arnetz conducted a study at Trinity Health in Grand Rapids to find ways to improve efficiency in primary care. It resulted in a new model that has nurses doing more work in less time, giving patients 40% more access.
If you ask personnel, the number one thing they complain about is inefficiency, that they have to work around, and all that takes so much energy.
Dr. Baer took a new approach to avoid burnout. He's among 12,000 doctors across the nation offering subscription-based concierge medical care. It gives him more time with patients and his family.
I think this also gives much more satisfaction not only to the patients, but actually to us on the provider side, because we can practice medicine the way that it truly has been. And if it wasn't for that, I don't believe I would still be able to be practicing medicine today.
An article published by the Harvard Business School says some doctors spend more than half, 55% of their workday doing paperwork. It suggests AI could reduce physician burnout by eliminating administrative tasks such as completing charts and insurance matters. In Lansing, Michigan, I'm Ann Emmerich.
Still to come, a young woman struggled to love herself.
I actually hated what I looked like.
But after she found her calling, a new challenge would put her faith to the test. What inspired her to rebuild her life and advocate for those like her.
But first, a woman inspires others one stride at a time. The safe space she's created to help more women enjoy running at their own pace.
You can watch Investigate TV Plus anytime, streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download. Joining a run club can be fun, but it can also be a challenge if you're not as fast as the other runners.
For those who may need a little bit of extra time finishing, a Georgia woman created the perfect safe space. Reporter Sawyer Bussey shows us how she's empowering people to run at their own pace.
30 degrees on a Saturday morning. I was a little worried that people wouldn't want to be out here in the cold weather. Sounds like the perfect day for a run.
Came from Decatur, Georgia. 45 minutes to hang out with the crew.
For many of these women, runs with other run clubs have had their challenges.
You want to meet these people that run with you, and then, they just run so much faster than you, so you don't really get to meet them because they're away from you.
This day is all about freedom. Freedom to love a sport and not feel like they're too slow to keep up and enjoy it. It's a change of pace for sure.
Are you excited about today?
Yes, I'm extremely excited about today.
What are you expecting?
I'm expecting for people to be beside me.
The group is called Best for Last, started by runner Tatiana Forbes.
And I didn't see a safe space, so I created one.
The clubs are free to join and open to all runners, whether you run a 10-minute mile or walk a 20-minute mile.
We've been running on our treadmills in our garage or walking instead of running because we're too afraid to try. So I think what's happening is because people are seeing that this space is available now, they're coming out of the shadows.
This is a place for women to find community, to run without judgment, to switch up the narrative.
During that story, we're having a debate here in the studio. What did you say? If you're talking while you're exercising?
You're not exercising hard enough. I don't remember where I got that from, but
you were like a big-time athlete.
I wouldn't say big time, but
you're athletic.
I was on the relay team
She
back
was on
in
the
the
relay
day.
team back in the day. Y'all win?
Ran the 4x4. We won a lot, actually.
See? Superstar athlete right
Yes. I wouldn't say that,
Okay.
but anyway, get out there.
Get out there and
run.
do it. There you go.
Slow or
Thank
fast.
you for bringing us back.
Yes.
Yes.
Well, up next, Getting Real.
So it's been about 2 years now, and I would say I'm very accepting of my reality now.
How an aspiring model turned her pain into inspiration for others.
At 25, Diamond Janice is dedicated to inspiring young people through her modeling career, though her path to the runway wasn't easy.
As a teen, she battled depression, but everything changed one night nearly 3 years ago on her birthday, when a life-altering event would test Diamond's strength and resolve. It was then that her faith would guide her to an even bigger stage. Flipping through the pages of a magazine, everything looks picture perfect for Diamond Janice.
This was in Mississippi.
But it was a different story as a young girl, where Diamond struggled to love herself.
I really had low self-esteem. I actually hated what I looked like.
She eventually found her purpose one afternoon at a neighborhood thrift store.
I was in there by myself and I just started seeing like all the clothes and different fabrics and just started putting looks together.
Throughout her teenage years, Diamond would share those looks on social media. She began taking modeling seriously in college, actually booking jobs and working with agents. By 23, Diamond was entrenched in the fashion world and invited on the trip of a lifetime to New York Fashion Week, a 23-hour journey that began in Houston in an RV with 7 others.
We're on our way to New York and like everybody's excited, and it just felt like that we were about to embark on like the time of our lives.
But the ill-fated trip would end in tragedy. A terrible crash on a dark Virginia highway.
I remember just getting in the bunk and opening the window, and I lay back and I went to sleep.
Diamond woke up in a hospital ICU. 2 other passengers were killed. Her life changed forever.
My back broke in half.
Diamond was paralyzed from the waist down.
No one really had to tell me. Like, I already knew, like, I can't walk, I can't feel. The question is for how long?
It's been a roller coaster of emotions for me, to say the least.
Diamond's mom rushed to her bedside in Virginia.
I was in shock. I wasn't able to process. I was just numb. Like, I can't believe this is going on.
Look cute, girl.
Thank you, girl.
She's now with her mom in Louisiana, building a new life.
How are you accepting your new reality?
So it's been about 2 years now, and I would say I'm very accepting of my reality now. Like, not walking is one thing, but it's kind of all of the other things that it comes with, like the loss of bladder functions or neuropathy. So it kind of feels like fire ants are like eating away at me at like all times.
Neuropathy, or nerve dysfunction, is common in people with spinal cord injuries, causing agonizing pain. But Diamond fights through the physical and emotional challenges.
Diamond is an aspiring mental health counselor dedicated to fostering healing and
even pushing herself to participate in the Miss Louisiana pageant, the only contestant in a wheelchair to place in the top 16.
Let's hear for all of our Miss contestants in swimsuit tonight.
What were you thinking when you saw your daughter on stage at the pageant?
Oh my gosh, I was like floored.
I just loved that they were so open because I was the only one on wheels. Like even my mom didn't know it was like a normal pageant. Welcome to Grace Through Faith. I'm your host.
Diamond's new normal is sharing her story of faith and resilience.
I'm a model, I'm a communication specialist, and I love God.
She's using her new podcast, Grace Through Faith, to reach a broader audience. Now an advocate for the disabled, she organized a fashion show for Spinal Cord Injury Awareness Month, honoring those with disabilities.
She has like wowed me as a mother. Like I'm just like wow every day when I see her.
So she's an inspiration for you.
She is an inspiration for me. She's an inspiration for a lot.
In addition to being a model, Diamond is also helping others to hone their craft.
I have some models that I'm working on, just getting them ready, getting them acclimated in the modeling scene, and I'm just excited for what's to come.
No longer asking why this happened, but finding solace in the fact that it did.
She's like, Mom, this is how my life was supposed to be, because now I know I'm supposed to impact people that I would not have impacted before. So I accept what was allowed.
I'm leaning on God, I'm leaning on my community, and just leaning on my faith to get me through.
Diamond is still in therapy 2 days a week and is now an advocate for the disabled. She started a nonprofit called Wheel Queens Foundation to support disabled women. And that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching.
On the next Investigate TV Plus, challenging the gatekeepers of guidelines for high school sports.
They do not check and balance themselves, so someone else has to.
Our months-long investigation reveals how state athletic associations often hold unfettered power that can end careers and change record books.